Good day, everyone. I am Miss Syreah K. Ramirez, and today I am going to discuss about assessments for students with exceptional needs. Students with exceptional needs. These refer to learners with learning, physical, and developmental disabilities, behavioral, emotional, and communication disorders, and learning deficiencies. And today we're going to focus on one exceptional needs, and this is intellectual disability. Intellectual disability. Students are identified as having an intellectual disability on the basis of low scores on a standardized IQ test and consistent deficits in one or more adaptive behavior that adversely affect educational performance of their age or grade. Intellectual disability is a term used when a person has certain limitations in cognitive functioning and skills, including communication, social, and self-care skills. These limitations can cause a child to develop and learn more slowly or differently than a typical developing child. Intellectual disability can happen anytime before a child turns 18 years old, even before birth. So, intellectual disability is the most common developmental disability. According to the American Association of Intellectual and Developmental Disabilities, an individual has intellectual disability if he or she meets three criteria. First, IQ is below 70 to 75. Second, there are significant limitations in two or more adaptive areas. For example, skills that are needed to live, work, and play in the community, such as communication or self-care. And the third one, the condition manifests itself before the age of 18. So here are the two examples of intellectual disability. First is the Down syndrome. Down syndrome is a genetic condition that occurs in one of every 691 live births. It affects people of all ages, races, and economic levels and is the most frequently occurring chromosomal abnormality. So how teachers should assess students with Down syndrome? First, teacher should give the student fewer test items so that he can finish in the same time period as classmates. Then, use meaningful vocabulary and real-life situations. Then, allow the students to use tools such as dictionary and calculator. And use a scribe or give the test orally. Retest the same knowledge with different questions and in different ways. Repetition is the name of the game when it comes to phonics trainings. Learn sight words and vocabulary from the student's environment. No victory is too small. Set attainable goals and adjust difficulty levels according to each individual's capabilities. Learning just one letter or a new sound over a week is a sure win for a child with Down syndrome, so reward each accomplishment with badges and lots of praise. Design special assignments that cater to the student's strengths so that teachers can create opportunities for guaranteed success. The second example is the developmental delay. Developmental delay refers to a child who has not gained the developmental skills expected of him or her compared to others of the same age. Delays may occur in the areas of motor function, speech and language, cognitive, play, and social skills. Acknowledge level of achievement by being specific. Teachers should be specific when giving praise and feedback. Break down tasks into smaller steps. Teachers should demonstrate steps and then have the students repeat the steps one at a time. Teachers also should provide hands-on materials and experiences for students with developmental delay. Here are my references. That's all for today. Thank you.